Hello, this is Dr. Ford Brewer with heart attack, stroke, and cancer prevention. Today we're going to talk about telemedicine. Now, many people have asked me, well, what does telemedicine look like? They haven't done any kind of telemedicine, or at least that they know of. So I go through some of the basics on telemedicine, but before we get started, let's remember something. Docs have been doing telemedicine ever since the telephone was invented. Have you ever talked to the doc on the telephone? Yes. So again, telemedicine is not quite that strange and weird. Now let's talk about some other types of telemedicine that are out there. For example, the astronauts get full workup and evaluation and medical care while they're in space. You can even do surgery through telemedicine means. That's the Da Vinci telemedicine robot. And this is the doc operating the Da Vinci robot somewhere else, sometimes even a hemisphere away. A little bit larger picture of that doc doing that surgery. Again, what we're talking about is nothing like that. What we're talking about is, this is far more typical. It's a husband and wife who have questions about their heart attack and stroke risk, and they want to get involved and get an evaluation, but they don't want to make the trip to see the doc. They want to see the doc from their home. Just another comment about other types of telemedicine. So tele-stroke care is saving lives all over the country. It's the ability to get anti-clotting or clot-busting drugs for patients that are having a stroke, but they're an hour or half hour or so away from the nearest emergency department. You can look that up on the CDC. I ran the number 2 telemedicine company called MD Live, or at least I ran the medical staff. I was the chief medical officer. That's a very different type of telemedicine. It's basically cough, cold, allergy, headaches, urinary tract infections, things like that. So those were like 8 to 15 minute evaluations for the doctors on there. What we do with prevention, heart attack and stroke prevention, tends to be a much longer evaluation and involve a lot of labs and some other things. And I'll show you that in just a minute. A lot of those were just phone visits, and again with these, usually our first visit is video, and it's 2, 3, or 4 hours. It's a significant visit, significant time, because there's a lot of information involved. And patients still end up saying, gosh, there's a lot more information that I need to find out and to learn. Now, again, as we said, this is more like the process that you get when you look at telemedicine with us, a heart attack and stroke evaluation. So what's the first thing we do? The first thing we do is we find a place for you to get a CIMT. Remember, that's the ultrasound of the carotid artery to look for disease or plaque. Our staff will help you do that. The next thing we will do is help you find a lab and coordinate that for you. And we get an inflammation panel, obviously cholesterol testing, and some other basic labs to understand the biochemistry, because the biochemistry is what tells us whether or not you have inflammation and whether or not you're at significant risk for heart attack and stroke. We have staff, besides myself, very qualified providers who can see you and help you learn what you need to do and provide medications when and where appropriate. We use GoToMeeting. So basically you have a doctor on one end of the line, on one side of the video, and the patient. And if you want to have a family member with you, patient family member on the other side. Now here's some other things to think about. Everybody's seen these complicated scary lab values, we will give you, of course, your lab values. They don't come looking like that. They're much more patient friendly. They're much more understandable. In fact, here is a typical reading. As you see, we give you the actual test, the result, the date, and red, yellow, and green in terms of whether or not you have a problem there. Then also we have an explanation. And again, when you go through our labs and you go through the CIMT and you help the patient get started with root cause analysis and lifestyle discussions and then medication discussions, maybe that helps you understand why this turns into 4 hours. We'll have other videos to talk about questions on this process. Thank you.